So, what is all this we're hearing about GLP-1 medications like Ozempic and Wegovy, or Mounjaro or Zepbound? Can combining GLP-1 medications with the ketogenic diet lead to better weight loss and blood sugar control? Today in this video, I'm going to break down a little bit of the information about the GLP-1s, how they slow digestion and decrease or regulate your appetite, and they support the reduction of blood glucose and weight loss, but how a lot of people on these medications are never really told about nutrition. So I'm going to try to make the case for combining the use of these GLP-1 medications with the ketogenic diet approach to see if the weight loss will then be sustainable once you stop the injections. And that is one of the big problems with these medications. So let's get started. Remember that the information in this video and on my channel is just to educate you. If you have specific questions about your medicine or your medications or the use of these GLP-1s, you need to consult your medical team. I'm going to introduce GLP-1 medications. What do they do? What are some of the benefits of these medications and some of the risks and side effects? And then, of course, my final tips is always about how do we use this information in your daily life to address whatever it is you're working on to improve in your health. So a lot of these new GLP-1s are a once a day injection. These are things like Victoza and Saxenda. Some of them are twice a day medications that you inject, like Byetta. And then, of course, you have the once a week medication injections like Trulicity, Ozempic. These are things that you've heard, I'm sure, a lot about on social media. And a lot of people you know are probably using these for weight loss and blood sugar control. They were originally invented to help people with diabetes control their blood sugar a bit more. But then the pharmaceutical companies, were noticing that people were also losing substantial amounts of weight with these. So sometimes you have to qualify to even be given these medications. So what are the current qualification recommendations to be prescribed one of these GLP-1 medications? Well, you have to have a BMI of 30 or higher, which classifies you as obese. Or you can have a BMI of 27 or higher with at least one weight-related health condition, like high blood pressure or type 2 diabetes. So you do have to qualify with your diagnoses to be prescribed these GLP-1 injection medications. So what are some of the benefits of GLP-1s? They're actually called GLP-1 agonists that are originally developed for controlling blood sugar. They help to reduce your sugar, your fasting blood sugar, promote weight loss. They're a signaling hormone to tell the brain that you're full and you don't need to eat. They slow the movement of the food through your GI tract. And they're most effective when combined with some sort of dietary strategy. But unfortunately, the patients that I know are basically given the shot and told nothing about nutrition. So I felt like I needed to do a video on how you could combine the use of these. Now, I'm going to say that when these were first on the market, I was not excited about these medications at all. And why is that? Because as a metabolic health practitioner, I don't really like these single intervention kinds of things. I think you should always involve educating the patient, some lifestyle and nutrition strategies to go along with medication. I feel like these patients need a combined approach, not just a shot and you send them home and they don't know what else they can do. What I've seen over and over is that these patients go home with the shot, they're doing the shot, they're losing lots of weight, but they're still eating their junky old diets, which, really isn't changing their health. Yeah, they're losing a lot of weight, but they're really not changing their health, nor are they addressing their relationship with food. Now, why do I say that? Many times, not always, but many times, a lot of people with significant obesity have food addictions or eating disorders, and they need a comprehensive approach to dealing with food. They need to be a part of a support group. They need some counseling. They need to really address their relationship with food, which got them in this condition in the first place. Just providing a shot doesn't help the root causes of the obesity in the first place. So when these first came out, I wasn't really excited about it, but I have changed my opinion because one of the big things that these GLP-1s do is they help to reduce what we call food noise. That is that constant thing in your brain that's thinking about food. What am I going to eat? When am I going to eat? Am I hungry? Am I not hungry? It's just that constant preoccupation with food. And what we're seeing is these GLP-1 medications do seem to reduce that food noise in the brain. For people who have food addictions and eating disorders, this is a significant benefit. Of course, these medications, as most medications do, come with side effects that you need to be aware of. They create nausea, in some cases vomiting and diarrhea, headache, very low blood sugar because you don't feel like eating, gastroparesis, which is your stomach actually becomes somewhat paralyzed. It's not moving the food through. Therefore, these are rare side effects. Some people experience bowel obstruction or impactions, worsening kidney disease, and in very rare cases, they've been linked to some thyroid tumors. Another big side effect, I think, is once you stop the injections, you regain the weight rapidly because most people aren't then taught anything about nutrition. What could you do to sustain this weight loss? Now that you've lost 80 pounds, which is great, how can you really sustain it? Let's teach you about nutrition and some of the ways you can give your body some help in terms of keeping this weight off. So, there are certain people that this medication is not recommended for. These are people who have a history of medullary thyroid cancer or a family history of thyroid cancer. People with multiple endocrine neoplasms or have a family history of that disease. Anybody who has had pancreatitis in the past. Of course, pregnant and breastfeeding women, it is not recommended you take these injections. So these GLP-1s mimic the natural processes in the small intestine that tells the brain, you're full, you don't need to eat. They can result in significant weight loss. Yes, they can. They can help control your blood sugar, but they have significant side effects, which can be quite mild, just with nausea, occasional vomiting, occasional diarrhea, all the way up to some severe side effects that I mentioned. They need to be prescribed in combination with counseling, a support group, and a dietary strategy. Using these medications by themselves not only is not safe, I feel, this is my opinion, but also the weight loss and benefits are not sustainable. You have to address your relationship with food. Some of those root causes to the obesity in the first place. So, of course, Dr. Tidman would have you completely change your dietary approach. Reduce your daily carbohydrate intake. Take out all the processed foods and sugars to reduce your insulin resistance, which got you in this condition in the first place. Keep your proteins high, and I recommend when you're actively losing weight that you're also actively building muscle. So I recommend you take those proteins up to about 2 grams per day of your ideal body weight, where you're headed. This is because a lot of patients with significant obesity also have significant sarcopenia. That is a reduced amount of muscle tissue and some significant muscle atrophy. So I would want you to start doing something to build muscle. You can start in your diet by adding more protein. Of course, adopt a low-carb, healthy fat, or ketogenic, or carnivore diet. That's that continuum that I talk about in my other videos, the carbohydrate continuum. What is your individual carbohydrate tolerance? It's different for everyone. There are people who are very thin and very fit, and they can eat 100 grams or more of carbohydrates per day. There are others who have significant metabolic health problems, issues, obesity, metabolic syndrome, that need to reduce their carbohydrates very low, below 20 grams of total carbs per day. It really depends on you and what you're working on. How are you going to know? Well, you're going to test every morning with a blood glucose and ketone meter. Now, do you have to do this forever? Prick your finger forever? No. But when you're first getting started on this approach, I think it's very helpful to give you information on what your body is doing with your blood sugar and your blood ketones. So obtain a meter. I like the Keto Mojo meter. They're very cost effective. Increase your intake of daily fats. And you'll say, well, I'm trying to lose fat. I don't want to eat fat. No, it's not the fat that makes you fat. It's the carbohydrates. Increase that intake of healthy fats. Grass-fed butter, lard, beef tallow, olive oil, avocado oil. These are healthy fats. Take out all the processed foods, sugary drinks and sodas and juices. Take out all the grains. Really go low carb. And if you really want to focus on eliminating a lot of foods that may be trigger foods for you, go carnivore. Go back and view my Keto 101 series, part 5, where I review the carnivore diet and how beneficial it is for metabolic health as a premier elimination diet. Begin a daily exercise regimen that includes aerobics and resistance training. If you have bone health issues, also add some high impact training to your regimen. This can be as simple as some jumping, some marching in place, just using a weighted vest, heavy barbell training, maybe working out with a personal trainer at a local gym. Whole body vibration. These are things that you can help your bone density problems if you have both obesity and bone density problems. Add some MCT oil to your diet each day. It will really help you feel full and satisfied. It will really reduce your hunger, along with the GLP-1s. Try an intermittent fasting regimen. Take your meals down to 2 meals a day, fasting overnight for 16 hours, or occasionally do a 1 meal a day fast. This will really reduce that insulin resistance that caused you to store the fat in the first place. Join a support group or seek professional counseling to work on your food relationship. Some of those root causes that caused you to get into this condition in the first place. And develop a weaning plan with your prescribing doctor. That is, in my opinion, no medication should ever be prescribed that isn't also followed by a plan to wean you off it. This medication, it's even more important to develop a weaning plan so that you don't regain all of that weight that you've lost. These are references I used for today's video. I really hope that I have given you some new information and some things to think about on the use of GLP-1 medications like Wegovy and Ozempic and Zepbound. Initially, I wasn't excited about these, but now I do see the benefit if they are used in combination with a total treatment approach, a nutritional strategy, joining a support group, getting professional counseling to work on your relationship with food, and a weaning plan. How are you going to get off these medications? Please leave a comment below if this was helpful for you. And remember to subscribe to my channel and hit the notifications. Then I know that this information is being helpful and being used. And, post some questions. I would love to answer your questions. Thank you for stopping in, and I'll see you on the next video.